Good evening, everyone. Welcome to the webinar tonight. We have been hit by a massive storm in Cape Town, so I'm really hoping that we have continuous internet connection. I got an email this afternoon to say at 7 o'clock there might be some interruptions, it's pretty stormy out there. We in Cape Town have got water restrictions, so we really need the rain, so we're welcoming it, but I just really wish it would. I want to welcome Debbie Taraka to do the next webinar on rehabilitation for the cat. Debbie is no stranger to Onlinepethealth webinar. She lectured us on degenerative myelopathy. Debbie has got clinics called Wizard of Paws, and she actually started in the human field and then very quickly moved over into the animal field. And she has a wealth of knowledge. She has lectured all over the world, is involved in research, as well as co-authored many textbooks.
Thank you so much. And this is definitely, I often laugh because people will say, you rehab cats also? And, you know, there's definitely some different challenges in rehabbing cats than there are dogs. But the clinic, my clinic is called Wizard of Paws. And we probably see anywhere from 10 to 20% of the population are cats. And so I'm going to share the information with you and some helpful
Dave, if
hints.
You can hear me,
and,
you're not online.
Megan and I
not
were
hearing
speaking
anything
beforehand. And,
can you hear me, Deb?
Yes, I can hear you now. So let's see.
Seem to have... Let's wait a bit. Looking down to see at my phone to see where she is. Yeah, we seem to have lost her. Hang tight, everyone. Hopefully she'll be online. Oh, they can hear her. All right.
Can you hear me now?
I can hear you, Deb. Great.
Okay, good. Sorry about that interruption. Probably not storm related, more internet related. So I'm excited to present this on feline physical therapy. And as you could see, I have the question mark there because I'm often asked, you know, do you rehab cats? And I will be the first to admit, I definitely have a nice fear of cats, or a respect, I should say. So I've definitely been in many veterinarian clinics where there have been wild cats, and you know, just starting to understand them and, you know, learn from them, but also do what we can, you know, following the thought process that every animal deserves to live the best quality of life for the longest time possible. So when we look at, you know, feline physical therapy, and if you understand the fear-free attitude, I'm just checking to make sure everybody can hear here. Fear-free is a wonderful organization, and their motto, taking the pet out of petrified. And certainly managing both canine and felines in the same clinic requires a little bit of juggling. So we definitely, some common sense sort of things is to make sure that your cats are either separated from your canine patients, or they're in at different times. So we have a private room that we could see our feline patients in. Some of them get along quite well with the dogs. I have a Clumber Spaniel that's quite afraid of cats, so he sees them and takes off. But so definitely setting up your clinic appropriately. And I would highly encourage you, if you haven't heard of Fear-Free, is taking a look at their organization. And there are a lot of helpful hints to help reduce the fear and anxiety, using anything like pheromones or different scents to help calm cats down, because certainly, you know, they are a little bit different than dogs. They cannot be bribed as easily. And I also think with working with so many of them, they are our silent sufferers. So many times owners will say that they don't really pay attention, to their cats. They may notice that they're a little bit less active. They tend to be the pet that just kind of hangs in the background. If they sleep more, owners may not recognize that. So very important to get a baseline of what exactly is going on with your cat. It may not just be old age. It may be something else going on, arthritis, obesity. They could have a torn ligament, lots of different things. So when we look at some of the common problems, certainly obesity. I mean, we see so many obese cats, and this, of course, leads to other types of things with their health, from cardiac to diabetic, their thyroid. So, really being aware of that. Fractures, I've probably have never seen the same fracture in a cat. There tends to be so many different mechanisms of injuries, from jumping off of something, jumping out of a window or a sofa, or they're high up on a bookshelf or something like that. So each fracture is managed a little bit differently. Osteoarthritis. Again, this is something we may tend to think, oh, they're just getting a little bit older, but in reality, it could be osteoarthritis that is causing them to be a little bit less active, to put on weight, to go into the cyclical event. Abuse. I'm going to talk about a case of an abused kitten, and those two are never usually the same. There's usually different mechanisms of injury and different things that go on. Neurological problems, and I could laugh about it now, but I had a phone call a few years ago from a woman in the United States, in Connecticut, who was a breeder of Maine Coon cats, and they're quite a large cat. And she had contacted me because she had accidentally sucked her main breeding cat, sucked the tail up in the vacuum cleaner. And he developed a traction injury to his spinal cord. And at first I thought, how could you have done this? And then she had told me she has 20 of these Maine Coon cats around. And but her main concern was that since this was her primary breeding male, she needed to get him back to breeding as soon as possible. So that we did get him back to his goal, and talk about a functional goal there of this cat. So that was quite a case. Saddle thrombus cases. There can definitely have had some success. It's definitely worth a shot. Again, improving their quality of life. If we look at working with each animal to help improve their quality of life and make it the best quality of life possible. So when we look at obesity, as I mentioned, feline obesity is often overlooked, and it's so simple for them to gain weight because they become less mobile, maybe due to osteoarthritis, due to an injury. Maybe there's a new pet, whether it be a dog or another cat in the house. They'll become less active. It's also relatively easy to overfeed cats. I know that I've watched friends' cats, and it looks like such a small amount of food. I always feel bad and wind up giving them more food. So it's fairly easy for owners to do this. We know 1 in 4 cats suffer from obesity. So, the math is simple. They eat too much and they exercise too little. So working with these cats and functionally trying to get them more active and get the weight off of them. And if we look at the cat body condition chart, and I like to show this to owners because, owners will say, oh, they're fine, they're not too bad. But when you start comparing to the chart and showing them what the ideal cat is, with palpable ribs, a slight waist, and their abdomen tucked in, and then you look at the overweight cat where a lot of fat over their ribs, a huge abdomen, and everything kind of jiggling around, and, do a comparison and give them something to shoot for. I always like to show them photos, and so they could aim for something. They, of course, want their cat to be more active as well. So it's always nice to then shoot for something. So we may have the owner come in and we classify the cat as overweight, and we're going to shoot, to become the ideal cat with, dropping however many, pounds within a reasonable time. And this is something too we'll go over with owners, that they have to be very careful. They don't want to have their cat lose too much weight, or if they are, certainly is it a metabolic disease such as hyperthyroidism, but tend to shoot for 0.5 pound a month. So to make something realistic and to help the owners with those guidelines. We know that obesity and the side effects, there's definitely heart disease, ruptured ligaments, respiratory problems, fatigue, diabetes. There's a greater susceptibility to certain types of liver disease, and osteoarthritis. And this is a picture of a cat from Canada, from a good friend of mine, Jen Panko, out in Aldergrove Vet, and she's we're going to see a video of Rock and Rhonda doing some work. But some activities that I always like to give the owners homework, and this is a common part of our rehab protocol, is to give them 3 homework assignments to do with their pet, whether it's a cat or a dog. And there have been studies done in human medicine. If you give a human 5 exercises to do, they'll only do 3 of them, and they'll only do 1 correctly. So I always keep that in the back of my mind when giving owners homework, because you don't want to give them any more than 3 exercises, and making sure that they're doing it right. And then with cats, I've often found that there's 2 extremes of clients, and that either that they want a home exercise program and they just want to do it at home. It may be too stressful, or their cat may be too fearful to come into the clinic, or they want to come in on a regular basis. So there's kind of 2 extremes, and really figuring out what is going to work best. So when we, start with activities just to lose weight, certainly climbing up a cat tree. And if the cat is very food motivated, you can put the food on top of the cat tree. Encourage them to scratch on posts or pads to get some activity going, and what will stimulate the cat. Playing with other cats if they're friendly. Some cats running for a treat container, and just making a little bit of a shaking noise, to get the cat to move. But simple things, and these seem fairly simple to us, but for owners, most of the time they're a little bit more difficult. So I try to establish 3 things that the owners can do at home and work with that and give them that home exercise program. And then typically we'll follow up again in a month. So if the owners don't want to commit to regular visits, monthly visits are fine. And to keep them on track, have them check in via email, to let them know, let us know how they're doing, and also follow up with them as well. You can, other types of activities, putting little pieces of kibbles in specifically designed activity toys. And you can look on Amazon, and there's, or something similar, and there's different phthalate-free toys you can put kibble in to let the cat be more active. Walking is great, and you can put the cat on a leash, or you can just have them walk around the house. If the cat will follow a person around the house, you could do that. Core work, which we'll show pictures of. Water. And yes, some cats do very well in water, other cats not so well. So I always say this is sort of cat specific, if you will. So this video is put together by Jen Panko, and it is a story of Rockin' Rhonda and her weight loss history. So this was, and she wound up losing all of her weight and made her goal. And looking at either following like one of she followed the Hills diet, but following something to help her, with weight loss. And it's fairly easy for cats to get this large, and she was almost double her body weight. She had quite a bit to lose, or she was more than double her body weight. So working on, following a guideline of exercise and diet restriction, all so important, to work on. So when we look at fractures, and as I mentioned, they come in all different shapes and sizes. And if we remember the prime target of fractures, we want to let the area heal appropriately, but also according to Wolff's Law, bone is going to form according to the stresses placed on it. So when safe, we want to start doing appropriate weight bearing on the joint. And this is important to, again, look at the fracture healing, looking at what needs to be done, respect that healing process. And then we always look at what does the cat need to do. So with every fracture case that comes in, we're going to look at what bone was fractured and what is going to happen, what's going to, have to be, perform. So if it's a hind limb fracture, that cat is going to need to be able to jump off the area. So that's going to be very important. So you have to figure out what the cat needs to do. With ligamentous injuries, and we often hear of cruciate injuries in dogs, but cats do get a lot of cruciate injuries. We've seen a lot of patella injuries, and certainly deciding what is going to be most appropriate. Is conservative treatment going to be best, or is surgical treatment going to be best? One of the things that we can see Jen here working with Rock and Rhonda, balance and proprioceptive work for the cats is very important. So just that weight shifting and moving back and forth. And this is going to help us with any ligamentous injury. I have a cat that we're treating right now that does have a cruciate injury. It's a non-surgical case due to other medical issues. And we're spending a lot of time working on balance and proprioception and working on her core. So really doing a lot of balance work on the phthalate-free stuff. So, working on that kind of thing. So what we want to do, functional weight bearing. So with functional weight bearing, we're going to set up areas to encourage weight shifting and weight bearing. If we look at this slide, we can see that she's got her forelimbs up on a block, and then we have her hind limbs down on the ground. By elevating the forelimbs, we're increasing the weight on the hind limbs. So doing something simple like this will increase the weight onto the hind end. So this is a great exercise to do, and you could do it while you're feeding and things like that. Functional activities. So here's a picture of an outdoor playground where the cat will walk up and down. Certainly walking up, down, and working on slides and things like that. Slides, stairs. So cats going up and down stairs are important. So function, you could put a cat treat, and moving up and down is a fantastic way to do things like that. This was an abuse case that we had come in. This little girl was had a fractured ulna, and you could see, looking at the pictures, it was her left ulna that had the issue, and she was brought in by animal control, and the fracture was put on surgically, and she was then kept in animal control, and we started to rehab her. And she came into our clinic twice a week. We used photobiomodulation or laser onto the area to help with the healing. This took 2 people, one to keep her occupied. She was only 9 months at the time, and she was quite quite busy and wanted to be entertained. And so we had lots of toys and everything else going. And so, I mean, she was, quite fun to watch and to work with. We put a harness on her, and which I would recommend if you can. They make small, this harness is by a company called Comfort Flex, and they make cat size harnesses, also petite size, which works great. So we did weight bearing exercises with the harness and a lead. And so she's on this Nubby Infinity right now, and we're just working on balancing her side to side and working on that activity. As she's doing that, we're trying to get more weight on that left forelimb. When she would let us, we would pick up the right hind limb, and that would encourage weight bearing on that left forelimb. We were using a little bit of a toy for her to then start climbing up. But our goals were full range of motion, the ability to climb, and the ability to safely jump. And from the animal control situation, she was looking at being adopted, and they wanted to go to a good home where she could be as active as possible. So here we're just having her stretch out, and this equipment is made by TotoFit. It's burst resistant, which I cannot stress how important that is with any animal, but also a cat. It's also phthalate free, so it doesn't exhibit any problems with chemicals or anything like that. We encouraged her to climb up using that left forelimb. So we gave her treats. We rewarded her when she would extend with that left forelimb. So we were increasing the shoulder extension and the weight bearing as well. And just different ways. We used cat food, her canned cat food, to stimulate her. The animal control officer wouldn't feed her before she came in, so she was pretty hungry and ready to go. So it will be great to get her motivated. So food is always a great motivator here. And we did put her in the water. This worked for a few sessions, and then I think she started to figure out what was going on. Again, she had the harness on, and she adapted very well, to the harness. It actually provided a little bit more balance and stimulation for her, so it worked very well. And she did great. We had the treadmill moving fairly slow, so she was working on that left shoulder extension very nicely. here she is just eating her fancy feast cat food, and we were doing some weight shifting. And this is my team here. We got her all better in 2 months, and she was ready for adoption, and she went to a wonderful home, and we get monthly updates on her, and she's doing great. She has a slight leg length discrepancy on that left forelimb, but she's able to jump around and play and enjoys life and does all normal cat things. So that was just a wonderful, wonderful case. Our senior cats, certainly, they're also, they have less motivation. They don't have as much stimulation. A lot of times they could be grumpy. So we highly encourage, and we will educate our referring veterinarians that if they do have senior cats coming in and the owners are worried about them not getting enough stimulation or gaining weight or possibly painful joints, to start an exercise program. And this is something, typically they come in for 1 or 2 visits, and we set them up on a core program and have the owners do it at home. Because again, most of the time the cats feel a lot better with their owners at home, so they do nicely with it. And this something similar like this is a senior cat. He's 14 years old. He's wearing a harness, and what we'll do is just have him lie on this disc and just start to do some weight shifting. So we could do it with food or treats. We'll use something that's new and exciting for them. So it'll, be something that they'll want to work for. Say little pieces of, we've been using freeze-dried minnows, and the cats usually go crazy for those. They love to do work for those. We can also do some standing activities. So standing on, again, a phthalate-free surface and performing weight shifting. And doing the weight shifting on an item like this, on a disc, you can feed the cat while they're standing there. And this will help them with a little bit of core, put on some more control of their body. So it'll help facilitate caloric burning. It'll also help with their energy. And typically I tell owners, if they can do something like this 5 minutes twice a day, it'll make a huge difference. And again, if we look at our seniors and trying to get, looking at the best quality of life for the longest time possible, this is terrific. And we can progress to different things. And here are a few different setups, getting a little bit more challenging, having the cats just step over these objects, putting a few things together. Of course, making sure that they're safe and the practitioner is safe also. I want to make sure the owners feel comfortable with this. And they, if the owners can't afford to buy any equipment, we'll ask them to use cushions at home or something like that will challenge their, challenge their balance. Pain management, such a vital component of rehab, is pain management. And of course, anytime a cat comes in, or a dog for that matter, if they're not responding to something that we're doing, we'll want to make sure a reassessment is done. So as we know, pain is going to inhibit healing. And there's definitely the pharmaceutical approach, but there are also modalities that may be utilized for pain relief. And I always joke, choose what the cat will tolerate the best. Electrical stimulation may not be tolerable for a cat. I personally have only used electrical stimulation on one cat, and otherwise I don't. Photobiomodulation or laser is the most effective, either a class 3B or a 4, whatever is going to work best. But I find that this provides a lot of pain relief and is something fairly simple to do. And we have quite a few clients that bring their cats in either every other month or once a month for laser therapy or photobiomodulation for pain control of their osteoarthritic cat. And it works very well. They find that's more effective and more tolerable than a lot of the NSAIDs or pain medication. And on a lot of your laser settings, they have settings for cats, so smaller dosages, and you can program everything in. This is one of the older light cure models, but a lot of other models have the same. The Assisi loop or something similar with pulsed electromagnetic field therapy also works great. The Assisi loop is wonderful if the animal won't tolerate being in the clinic. This is something that could be sent home with the owner, and they could do this at home. And the treatment area is going to be whatever is within that loop. So if there's pain, if there's inflammation, there's a wound, this is fantastic. And the owners can do this at home once or twice a day, depending upon what they're treating. And the cats tolerate this very well. Moist heat, some cats do very well with it. Of course, others don't. And you have to be very careful not to overheat. Overheat or burn the cat. And many times cats will choose warm areas to lie on. I found that a lot of arthritic cats will seek out a heating pad to lie on. Also, some companies have the pulsed electromagnetic field pads or beds, and the cats will seek them out on their own. I thought this was a funny picture. So when setting up a plan, you have to determine what is going to work best for the client and for the cat. As I mentioned, the easiest, sometimes it may be setting up a home exercise program, and that may be the best thing for them. Or, coming in on a regular basis. And cats have a lot of different personalities. As we know, some are going to tolerate water, others will, not at all. So what is going to work best? The same thing with pain management and osteoarthritis. What will work best for the, for the owner and the cat? We typically do not board cats for the day, just because they're so stressed, and we don't want their fear or their stress to inhibit any of their healing. So we also will set up where the owners could bring them in at various times of the day, to make it convenient. So as I mentioned, the fear-free treatment area, setting up an area free of dogs and other animals, and making sure that the area is comfortable for both the owner and for the cat. If the transport case, if you can just take the top off and treat the animal in the transport case, that's fine. And that may take a little bit for the dogs to get used to. We want to set the owner and the cat up for success with everything that we do. And I want to send a special thank you out to Jen Panko at the spa, the vet rehab girl. We joke, we call her the Wizard of Claws, since she loves working with so many cats. So thank you, Jen. And I know there's been some issues with the internet, and I'm getting some messages here. So with the slides being stuck, I don't know if it's the storm or, but I'll see if we can get back to Meg's here to see.
Do you want to try?
There's been some questions about the Comfort Flex harnesses. Typically with the shoulder, with the harnesses, most cats take accept the harnesses fairly well. They are very sensitive, absolutely. We feel that it's a lot safer to handle, so we'll, work with them and maybe give the owner one to take home to just get them used to it. A lot of times with the Comfort Flex, the chest strap is a little bit higher than their actual chest, so there is no irritation, but there also is no choking there. So I haven't found that the Comfort Flex harnesses bother the shoulders or the joints. Again, there are some cats and some dogs that they don't work well with, so we'll switch to something else. So, we'll see what will work best. I'm going to switch. We'll see.
Can you hear me, Dave?
Megan is there. It's always fun doing these things with major storms going on.
Yeah, Deb, can you hear me?
I can hear you, yes.
Oh, okay, great. Yeah, so we had a bit of a problem. I think at one stage the slides just got stuck. Everyone could hear
Oh,
you, but they couldn't see the slides. But yeah, it must have been an internet problem, but no problem. I think it'll be fine in the recording.
okay.
There are a few other questions. I actually wanted to ask you a question. I can remember when I did the CCRP, the one thing I do recall about learning about cats at the CCRP, that I remember David Levine saying there was a connection between cats that had cranial cruciate ligament ruptures. They often had a cardiomyopathy, and I wondered whether you'd seen that at all.
So, great question. I have heard that as well, with ligamentous injuries in general in cats and cardiomyopathy. I don't know the data on that, but there is a correlation with that. So certainly watching, monitoring the cat, cardiacally, or from a cardiac standpoint as well. So yes, and as you said, with cruciate ligaments, but also other ligamentous issues. We've had some cats with carpal ligamentous issues, and the same thing, they've suffered with cardiomyopathy.
I must say I never saw it, but I do remember that. And then I wanted to ask you a question about there's quite a lot of controversy about using those laser light to get
Mm.
cats sort of stretch up onto walls and to do exercises. What's your opinion on that?
Yes, great question, because I know that could be a motivator. I know on the canine side that's been linked to some potential neurological issues, even some seizure issues and things like that. So I don't recommend that. Um, just to make the cat too crazy. If that's the only option to get the cat moving, then maybe in a very limited basis, but I typically do not recommend that. Again, and that's coming from the canine side, just from their ability to kind of make them a little bit nuts. So
We have a question. How does one train a cat to accept a harness as they're so sensitive? That's from Di.
yeah, and we'd start that really slowly with most of the cats do accept the harness fairly well. If we're having a tough time with it, I will send one home with the owner and have them try to put it on, and while they're eating, reward them very positively, when they have the harness touching them. And work slowly with it. If it's something that's absolutely stressing the cat out, then we'll figure out another way to work around that. So yeah, there's lots of different things that we could do.
And have you had much luck with wheelchairs with cats? You know, I mean, I know I'm not sure who you use in the States. We're very lucky. We've got rehab a pet here in South Africa, wheelchairs, but obviously with the cats, they have to be quite light. And that can sometimes be a bit tricky, especially if it's quite a slight cat.
Yes, and we've definitely had a few cats in. A lot of the situations have been trauma, where the cats are either missing a leg or have had an amputation for some reason. Some have with severe neurological issues, and it really depends upon the cat. Some have done fantastic with their moving. It does have to be light. It has to fit the cat well, and we start off with very short periods of time. So maybe under a minute, to start with, and start to work them into it. We've been using a lot of pheromones on the objects, just again that scent, the smell to assist and to help with everything. But some cats it is going to work with, some it's not. If that's an option for a cat that you're working with, I would definitely recommend attempting a cart out, before. So we usually ask, if clients, after a cat has passed that's been in a cart, if they could donate it to our clinic. So at least we can show it to other clients and then, see if their cat will even tolerate it. Because sometimes it won't happen no matter what.
And then Deb, obviously cats don't love water, and there's some of them that they'll tolerate swimming. And have you got any tips cats used to hydrotherapy, whether it be swimming or underwater treadmill?
Yeah, and some cat, it's either, I think it's a very hard line. Some are going to do it and it's fine, and then others just absolutely hate it. Um, we've definitely had blood drawn with cats going into the water and not wanting to it. With the underwater treadmill, we will introduce a cat to the area and only put a half an inch or maybe 2 centimeters of water in and feed the cat in there. So while the water is, just staying low, and get them used to it, and, then start to build up. Maybe move the treadmill just with a little bit of water, but using food and, really trying to reduce that panic. But sometimes it's just not going to happen. There's cats that will not even go near water. We're not going to try. And if, it's not worth the injury for us or for the cat.
I think that's the thing with cats. You just have to be very adaptable. Just adapt to tolerate. I must say, I never found them to be very food driven in the underwater treadmill at all. I think they were so stressed that they never really were interested in food. I did see another question there. At what point do you start doing weight bearing or weight shifting exercises with cats with fractures?
Oh, good question. So this is really going to be dependent upon the fracture and if it was repaired or is healing. And so I really rely on the orthopedist to give me that information. But typically it's anywhere from 2 to 6 weeks post, trauma, post surgery. And again, it'll depend on the joint and, what the severity of the fracture was. But usually like beginning on low level weight bearing, for example, putting the cat on one of the infinities and just rocking side to side, that works a lot. Just to get some gradual weight shifting, and that will be helpful. But really depending upon the fracture repair and how everything is going.
And then Candice asked, have you got any experience using catnip? I know you mentioned the pheromones. Do you use catnip at all?
Yes, we will. And some cats, again, do great with the catnip. Others could care less. I have found that sometimes it makes the cats too crazy. So depending upon exactly what I want to do see, but it's definitely, worth a try. So if they'll go with it, absolutely.
Yeah, in South Africa, we got, I'm sure you guys too, the catnip spray. And I used to spray it on my hands. But yeah, I can also recall having a few cats that just, you can't even treat them. They're going so crazy.
Yes,
I also want to talk to you about, Deb, in my experience, cats are very, very responsive to magnetic therapy. And you mentioned the CC loop. In your opinion, do you think that they respond better than dogs to magnetic therapy, or if you haven't found that?
It's tough. I think we're more. I'll suggest the CC loop more with cats for home use because it's just easier with things. And I agree with you. I think they respond very well, and sometimes better than the laser because there's no direct contact and they're kind of doing their own thing. I don't know if it's better than dogs or, I think dogs, they respond better to a lot of different things because they're just, like touch more. But they do, I am always impressed at how well they respond to the, things like the CC loop because, they do well with it, and I think they're more independent with those actions. So that's nice.
So I've got a magnetic bed called a beamer. So
Mm-hmm.
South Africa, we haven't got the CC loop yet here. It's like a bed that so you can push start. And I used to have this cat that if you push the start, he would purr and purr and purr. And then the client used to trick him and push stop. And then he would turn and look at us. And then you'd push start again, and then he would start purring. So he definitely sensed therapy.
Yeah.
All right. Let me see if there are any more questions. Has anyone got any more questions? Lots lots of interact with the water, which is great. It's great to see you
Yeah.
guys helping each other out and just giving each other tips. Um, Lots of things about crazy kitties and catnip. But Deb, that looks like that's everything.
Okay.
Thanks, everyone, and thanks, Deb, for the very interesting webinar. I'm sorry, everyone, about the poor connection, but hopefully the recording will be fine. If not, then I can use the audio and do some recording with Deb's PowerPoint to get the recording to you, so it's all working perfectly. Have
Perfect.
a wonderful evening. Thanks so much, Deb. Have a
Thank
great
you.
afternoon. And everyone in Cape Town, keep warm and safe.
Yes, keep safe. Bye bye.
Thanks, Deb. Bye-bye.